Now let's dive deep into this big LGBTQ story for today. I'm Greg Shapiro, and let's queer up health. Fenway Health halts gender-affirming care for minors amid federal funding threat. Boston's Fenway Health, one of the country's largest LGBTQ+ health providers, has stopped offering hormones and puberty blockers to transgender patients under 19, citing new federal rules tied to its funding status. The clinic said in a letter to clients that it must comply with U.S. Health Resources and Services Administration rules to keep its designation as a federally qualified health center, which allows it to provide care regardless of ability to pay. As the Boston Globe reported, quote, it could lose its FQHC designation and funding if found out of compliance with federal rules, end quote. In the letter, the health provider said, quote, this change in position is a response to a shifting federal landscape that requires us to adapt in order to remain compliant, sustainable, and able to provide healthcare, support, and services to all our patients and the community. The status loss would significantly change our ability to meet the needs of all who rely on us, end quote. Boston Children's Hospital and Boston Medical Center remain options for trans minors seeking care. Still, the move dealt a blow to many families. However, as Lisa Thornton, a mother who moved from Florida for her trans daughter's treatment, said, quote, we will always find a way, end quote. Well, this is yet another example of the lovely Project 2025 playbook doing everything we were warned about. We were warned. And he was still elected, and now they're doing everything they said they would do. I'm sure the folks at the Heritage Foundation are popping champagne corks even as we speak. But one of the most shocking things about this is that it's happening in liberal, progressive, less left-leaning Boston, but it just proves that even they aren't immune to this.
Well, that's exactly what I was going to say. You know, at least there are options. Mm-hmm. In Florida, they're going to be threatened with the same withholding of funds, and we don't have the infrastructure for other services.
There's no other alternatives, right?
You know, and that's just terrifying.
Yeah, it is really. It's a very frightening time
and frustrating. I'm sure.
Yes.
For people who just want to live their lives.
Yeah, right. Get the health care they need.
And puberty blockers after you turn 19, I'm assuming, are not as beneficial.
Right. That's right. There's a reason that it starts earlier.
Yeah. Yes. Well, that is a big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.